Crown Princess Mette-Marit of Norway and her battle with pulmonary fibrosis. Hello and welcome to the channel. Every now and again we hear of a public figure who is asked about a particular health issue they may be going through, and they are not only willing and able to share insights into their illness, but sometimes they go all out to use their experience to educate and inform others about their ailment. This is more than altruistic. I find it extremely noble and very generous because the information about any illness is useful to people who have that illness. It is for this reason that support groups are very helpful for others who are just starting out in their hard journey through a particular disease process. Many celebrities do this health education, as I call it. Kudos to them. It is not easy to talk about serious illnesses that one may still be going through, not being sure of the outcome, how your public persona will be affected, or how vulnerable this sharing of private details might make you. A few particularly touching cases are Jade Goody, who was a 27-year-old British reality show contestant who sadly lost her life to cervical cancer, but not before she had made a huge impact on the uptake of cervical smear tests by young women by the time of her passing in 2009. British TV presenters Gloria Hunniford and her daughter Karen Keating. Karen Keating passed away from breast cancer in 2004, and her mother, Gloria Hunniford, campaigned tirelessly for breast cancer awareness in the wake of her beloved daughter's death in 2004. Irish singer Sinead O'Connor and her struggles with mental health issues before her passing in July of 2023. Dame Deborah James, a British journalist who lost her life in 2022 at the age of 40 to bowel cancer, and who hosted a podcast named You, Me and the Big C, which chronicled her battle against cancer. Very recently, Alex Ohanian, the husband of Serena Williams, has revealed that he has been diagnosed with Lyme disease. I'm going to add to this list Crown Princess Mette-Marit of Norway, the wife of Crown Prince Haakon, who was diagnosed with pulmonary fibrosis, PF, in 2018 and has fought bravely against this disease ever since. Even though she is often absent from important state events, like this gathering marking the Golden Jubilee of King Carl Gustaf of Sweden in September 2023, she is using her platform to educate and inform others about her illness. I don't know many celebrities who have talked about this disease. The only two that come to mind are the actor Marlon Brando, and at least if you're British, you may know the mother of British glamour model Katie Price, otherwise known as Jordan. Now, I have to say, whatever anyone thinks of Jordan, I find her to be an excellent advocate for health issues. She uses her platform well to publicize health matters. She, of course, has a son with a rare illness, Prader-Willi syndrome. I, of course, know many non-celebrities with pulmonary fibrosis. My own patients. One of my saddest memories of the COVID pandemic was to witness the sad passing of my vulnerable respiratory illness patients who were succumbing one after the other to this vicious virus. There is a reason that pulmonary fibrosis is called a terminal disease. there is no cure. Prognosis is 3 to 5 years. Essentially, the lungs thicken and stiffen up due to excessive deposition of collagen and other fibrous tissues within it. This fibrotic process disrupts the normal architecture of the lungs, impairs, basically weakens the lungs' ability to exchange gas, oxygen and carbon dioxide. Of course, the whole point of breathing, as you all know, is to get oxygen into the body and release carbon dioxide back into the atmosphere. This process is severely hampered by pulmonary fibrosis because the lung compliance, the elasticity of the lungs as you breathe in and out, is severely reduced due to the stiffness which is caused by the fibrosis. So what causes PF? Well, the hallmark of a vicious disease is its unknown origin. The majority of pulmonary fibrosis cases are so-called idiopathic, meaning we have no idea what causes it. The rest are secondary to something else. For example, occupational and environmental exposures, things like asbestos, certain organic dusts, certain medications, for example, certain antibiotics, certain heart medications. Amiodarone is a common one that can cause pulmonary fibrosis. Certain chemotherapy agents or medicines. Radiation therapy. If you need radiation therapy for cancer treatment somewhere else in your body, for example, it would be a very good idea to protect the lungs from the bad damage that the fibrosis can cause to the lungs. Even getting a normal X-ray or a CT scan, if accumulated over the years, can cause pulmonary fibrosis. Autoimmune illnesses such as rheumatoid arthritis or systemic lupus erythematosus, SLE, all cause pulmonary fibrosis. What symptoms do people with pulmonary fibrosis suffer? Well, the biggest one has to be shortness of breath. This can sometimes occur even when the person is not doing anything, but it generally starts with shortness of breath on exertion, what we call exertional dyspnea. Mostly, sufferers have a dry cough. It's a kind of irritating chronic cough, persistent. Usually you don't cough up phlegm when you cough with this particular type of cough. There is definitely fatigue and weakness due to the reduced oxygen levels in the body and the increased effort it needs just to breathe. Some people complain of chest tightness and pain, again due to the extreme effort that one has to take or has to make to allow the lungs to expand enough. Remember, the lungs are actually stiffened up, so it takes more work to breathe. Clubbing of the fingers. Now, this is a kind of enlargement of the ends of fingers and toes, which is as a result of the chronic lack of oxygen. A picture is shown here. Finger clubbing is a particularly iconic sign of this disease, and many other diseases, in fact. Every medical student knows at least 17 causes of finger clubbing. It's a well-known pathology in medicine. Often patients with pulmonary fibrosis, PF, tend to lose weight unintentionally, either because actually to eat is quite an effort, so many people lose their appetite, and due to the medication involved, sometimes your appetite is simply lost because of nausea, vomiting, etc. How do we diagnose PF? Well, the very start is simply to ask the patient some specific questions about their lung function to identify the particular symptoms that they have, breathing problems, chest pains, etc. Examining their chest is already quite indicative, quite illustrative, quite representative of the typical findings that you get. Very often when you listen to someone's chest, someone who has pulmonary fibrosis, you hear what we call crepitations, crackles. These are pretty fine. It's almost the sound you can make when you rub two fingers together. It's quite distinctive. And then, of course, you move on to imaging. So you do a chest x-ray, that's very telling. Sometimes a high-resolution CT scan, which, again, is very informative. Very often, a lung specialist will add on pulmonary function tests, so lung function, what we call the LUFU test, L-U-F-U. I'm not being rude. It's the shortcut for lung function tests, LUFU tests. And these are very useful because they can differentiate between the type of pulmonary or lung disease that pulmonary fibrosis causes, what we call the restrictive type of lung disease, and this is very much in contrast to what we call the obstructive lung diseases like asthma and smoking-related chronic bronchitis. Blood tests are always useful, certainly to find out or exclude other causes of shortness of breath, for example, and very often a lung bronchoscopy, an imaging from the inside with a tube, a bronchoscopy tube, is often necessary in the workup for PF. And finally, lung biopsy. This is particularly useful if you want a very specific diagnosis where the illness is coming from, and certainly as a prerequisite for lung transplantation as well. How do we treat this? Well, oxygen. All patients in the end, well, maybe not all, but a huge percentage of patients will at some point in their journey require oxygen therapy at home. And this can be as much as 16 to 20 hours of oxygen. It's quite a hellish experience. Medications such as pirfenidone and nintedanib help to slow the progression of fibrosis. Steroids and other immunosuppressants are often used in cases associated with autoimmune disease. Pulmonary rehabilitation is a very important part of the therapy. You often need board-certified physiotherapists who specialize in lung treatment. Lung transplant, of course, as I've mentioned, is sometimes considered for specifically chosen, specifically eligible patients with advanced disease where no other treatment options are possible. And of course, supportive care, which includes palliative care, especially for people approaching the end of life, sadly, and for sure throughout the patient journey to manage symptoms such as the cough and shortness of breath. How does PF impact everyday life? Well, there are the physical symptoms, of course, which gradually reduce exercise tolerance. So unable to go shopping as previous, unable to go for a run or just sing in a choir. There are so many limitations. It's quite tragic. The fatigue is a major problem. And this is often something that impacts daily activities of living, such as bathing, dressing, and even cooking. Anxiety and depression accompany most chronic illnesses, and PF is no exception. PF can also lead to social isolation, which obviously can also exacerbate anxiety and depression. The physical limitations often means that you can't go out and join your friends or your family members when they go out hiking or sailing or playing some other sport. It's quite limiting. And this is exactly why a support group of some kind is absolutely necessary. Of course, PF impacts work. For example, physically limiting work. If you are a construction engineer or a farmer or something of that nature that requires physical effort, then basically your working life is over soon after diagnosis. The financial strain, this is of course an obvious one. Obviously, if you cannot work, you cannot earn money, and very often the treatment and therapies also add additional costs. Very often patients' homes may need to be modified or adjusted in some way to cater to their new way of life. Perhaps a bed would need to be moved from upstairs to downstairs because they can't go upstairs anymore. Perhaps there would need to be an upgrade of the home to allow for an addition of a downstairs toilet and bathroom. Yeah, the cost can really be a burden. Coping strategies, very important as part of this support systems network. Education and self-management. Now, this is where celebrities and others who have a wide-ranging platform come in. This is why I'm extremely admiring of celebrities who use their platform to educate others, to make such chronic illnesses a well-known and almost everyday topic so that it's familiar to us all, and we are therefore well informed and able to confront this illness if it affects us or our loved ones. Psychological support, crucial, with the aid of a psychologist or a psychiatrist. Pulmonary rehabilitation, which I've already mentioned, and the support group that I have mentioned already twice previously in this video. I pray that Crown Princess Mette-Marit of Norway makes the most out of a difficult illness. She's obviously getting the best care possible, and the love and support of the Norwegian people, not to talk of her own family, of course. Now, her relationship with the Norwegian people hasn't been easy, but through the years, it's become fortified. It's been a challenging start for her, but I think I can definitely say that with the time, with the years passing, she's gained the love and respect of the Norwegian people. I salute her work behind the scenes, championing lung disease. Her frankness and forthrightness, talking about her illness, is literally a breath of fresh air, pun very much intended. Do you or your loved ones have any experience with chronic lung disease? Which one? And how has it impacted your life? If you have any questions, by all means, feel free to ask Askadoc.